Hi, it's Doug Holland LMT with another massage tip for massage professionals. Today we're going to look at how to work the nuchal lines of the occiput to bring relief to tension headaches. How do we do that? Well, let's get down on the table and find out. So as we know, we have a superior and an inferior nuchal line at the base of the occiput itself. And what you want to do is we want to locate where the EOP is, that's the external occipital protuberance. We want to locate that on the back, and it sticks out pretty good. It's going to be almost, it's going to be mid-sagittal. When you touch it, you'll actually find it. So you'll find the superior line is just above that. So we're going to draw an imaginary line this way because it runs transversely, remember? And then, of course, the inferior line is just below that. They're pretty close together. But as we know, the superior line is where the trapezius muscle is going to come into. That's the most superficial muscle. Below that are going to be the suboccipitals that attach to the inferior nuchal line. So there's a couple of different ways I like to approach it. If we have a female that has hair like this is really good because what we can do is we can grab a hold of the hair right at the base of the scalp. You want to make sure you get a good handful of that. And we can actually pull that aponeurosis right there over the occiput. We can pull that aponeurosis and we can bring relief to those insertions there on those nuchal lines. So what I do is I pull, and if you see the body, kind of jump a little bit, you might have gone too far, but with her, she's not feeling any pain, and I'm able to stretch that tissue. And you can do a circumduction with that, a pulling motion, or you can just go side to side and pulling, or straight up. It seems like it feels the best though if you move superiorly when you do the pull. So pulling superiorly really works. Now if they don't have any hair to pull on like that to get a nice stretch in that tissue, then what we can do is I take my hand and I place my fingers on the almost all the way to the forehead, and then I use my thumb in a hooking motion. I work the inferior line by hooking my thumb into that tissue right there on the insertion, and then I work my way up to the superior line. Both nuchal lines need to be worked separately because of the attachment sites. I haven't really found a good way to work in a cross fiber friction. I try by using two thumbs, and it's kind of awkward because of where your fingers will pin on the side. You might even push it on their temple, and that would be uncomfortable. So I mainly try to focus. My tip to you is to hook that thumb into those nuchal lines and go right along them transversely like this, and you will open up that soft tissue right there. Those tendons will thank you. And you'll know when you're in it because a lot of people will start expressing, they'll start sighing and expressing a little bit of pain, but it's a good, healthy pain. This is something that people really love for you to do. I find it harder to do when the person is in supinated position. When they're prone like this, it's much easier to get to these attachment sites. Another tip that I have for you is I always drop the headrest if I really want to work this real well. If you have it, if it's even, if it's linear or even, well, it's harder to get to these nuchal lines this way. So again, just as a recap, we can pull the hair, circumduction, back and forth, side to side, or we can use the thumb and just use these four fingers here as a bracing on the scalp to work those two nuchal lines, and you will bring a lot of relief to those tension headaches that result from these points of insertion. Well, I hope you enjoyed that tip on how to help somebody with a tension headache that comes from the back of the head. And just remember this, if there's no discomfort on the table, well then we know it's nothing more than a foo-foo massage.